Hi, it's Dr. Nancy Zare, and I want to welcome you to another opportunity where I am going to actually share with you one of my very favorite personal therapists with whom I work on a regular basis, Dr. Sharon Sharpe. Sharon is with Achieve Therapeutics, and Sharon, tell us what it is you do.
Well, I use a lot of different techniques to try and move soft tissue that's either become stuck together or bound down in some way to try to restore balance in the tissues so that people can move more freely.
And I came to Sharon because of the fact that I had a broken wrist. I've had difficulty making a fist. Some of you don't know about that. I have a physical disability. I've also been in an accident where I wasn't raising my arm totally over my shoulder. So these are some of the reasons that I personally have been using Sharon. If you have a chronic injury, if you are in chronic pain, it's very worthwhile to check out what it is that Sharon can do, because Sharon helps with the fascia. Would you explain to us what that is?
Yes, inside our body, there are many layers of tissue going in different directions. And it's similar to if you peel an orange. Okay, so you take the peel off and there's this whitish stuff. That's fascia. And then you peel the segments apart and each segment is surrounded by fascia. And so it is with all our muscles, organs, all our tissues are surrounded by a baggie of fascia. And there are several layers, and these layers can get stuck together or bound down due to a postural issue or an injury. And although everything else might heal and come back, those restrictions have to be released in order for you to be able to move freely.
Right. So I am desperately missing having Sharon's hands on me. And I understand that she's not available until after June 8th. I will wait. However, she does offer individual and buddy sessions over the internet, like what's happening right now. So Sharon's going to demonstrate very quickly some of the services that you can take advantage of right now and not have to wait till June 8th.
Yes, well, it's all virtual, and you can go to my website and see the links. I do the individual session where you treat yourself, and a buddy session where you and a buddy would work on each other. And what I do is I'll guide you through a lot of different techniques. So I don't just show you something and say, okay, go ahead, do that, have fun. But I'm going to guide you, talk about pressure, talk about location and direction of movement, specific to what the problem is that you've contacted me about.
Right. So Sharon starts with...
There are lots of different ways.
Sorry.
For the warm-up.
Yeah, you start with a warm-up, which we're going to skip right now, but there is a warm-up where you move upper and lower body, make sure that you're in a warm situation, and then she's going to ask, as you will, why did I come?
Why did you come? Yeah. And then target whatever we're going to do based on that.
Great.
So I might have you do some motions to see where the restrictions are, and then we go from there.
Great. So would you demonstrate?
So what I would first have you do, I would have you just slide your hand across your arm. Okay, so we'll pretend your pain is in your arm and just kind of feel that skin move over the tissues underneath. So this is to give you a concept of the layers of tissue, and you can feel them moving around in there. And if this is where your pain is, then maybe you want to press a little. Okay, so we can use the palm, we can use the fingertips, we can use the knuckles, and we also can use some tools, things you might have around the house. So this is the size of a tennis ball. Nancy has a smaller one, and that's going to work just fine. And you can roll that right over the painful area, and that is going to help to separate those fine layers of fascia and help to release that fascia so that you can have the motion that you used to have before. This works great on a neck, works great on that trap, that knot that everyone has right there.
Oh, yeah. We all have those knots from hunching over that computer.
And if
Oh,
you have an upper back issue, you could also put this behind your back against the wall and then just kind of go up and down and side to side and let that roll over the areas that are affected. One thing that works really well on bigger areas is the rolling pin. This works especially well on a leg, but you know, you can just roll this. And this is going to get a bigger area than the ball would.
Right. So I'm so glad my grandma gave me this rolling pin, folks. And I saved it. This is an heirloom.
And then this is something everybody has. Just
yes, I have a fork.
And we're going to use the handle. And you want to get a handle that is sort of rounded and has kind of a beveled edge. You don't want to use a square one or something with a hard edge because you're going to be running this over your tissue. So let me get my arm in here. So you just want to start closer into your body and slide out. And as you slide over that tissue, you may feel bumps. You may feel different things.
I have some bumpy lumpies here.
Yep. So nice and easy and kind of at an angle. You don't want to go straight down, but almost like you were carving something. Okay. And then if you have, you know, a particular spot, like on a hand or something, you can just use the points and just do the same thing. And again, this is something I would really guide you through in terms of pressure and direction of motion, because it's really easy to push too hard with this, and then you end up with bruising.
Right.
Which is not what you're looking for.
Right.
But this really can move those layers of tissue over each other.
Right.
I also use a belt or a strap to help with stretching. Like you can do a really nice tricep stretch with this.
Okay.
Good shoulder stretching. Oops, my strap has disappeared.
Yeah, that's why I got rid of my virtual background. But folks, if this is really an amazing, gifted practitioner, a real healer. I use her in person. I use her virtually. You absolutely can enjoy the benefits of soft tissue release, especially for those of you with chronic pain. This is worth trying. So Sharon, I want to thank you so much for demonstrating what you can do. Again, go to her website. You can book an appointment, or of course you can call her up directly. To your good health, this is Dr. Nancy Zare.
Thank you, Nancy.